So before I start, I have been thinking of this presentation and this passage in the Bible. Sorry, I am not trying to preach to us, but it came to my head. My people are destroyed for lack of knowledge. How true is this word? In all honesty, I think knowledge is power, as you agree with me. And when we begin to look at our place of work, there are several hazards that are locked in there, which sometimes we may be aware of and sometimes we may not be aware of. But that knowledge, its power that will help us to become aware of these hazards and begin to think about how we can risk assess these hazards and what plan do we have in place in order to manage these hazards. So I know I'm talking to different people from different walks of life. I'm going to try to limit my conversation away from the classroom in order for it to be interactive. But by way of introduction, most of us, if not all of us, are aware of this hazard. Either it could be safety, it could be biological hazard, which COVID already has spoken well into this biological hazard that has disrupted the whole economic system. Physical hazards are also there, which are locked in our places of work. Economic as well as environmental hazards and other hazards are there. But touching on that, I just want to draw our attention on these non-communicable diseases that are likely to be associated with one form of hazard that I have mentioned or the other. But globally, looking at data from World Health Organization is saying about 41 million people every year die as a result of this non-communicable disease. And when we begin to look at this data inward, about 17 million people die before they reach the age of 70. And if we look at the data carefully as well, it's telling us that people within the low and middle income countries are most affected as a result of this. Now, most of these NCDs, I know I'm speaking to some medic among us, which we know cardiovascular disease account for majority of this, followed by what the data is showing towards cancer, chronic respiratory disease, and others. Now, we know that these NCDs may be caused by genetic or behavioral factors, and generally it have a slow progression and long duration. Now, I am not an expert in talking about the genetic, but I want to touch more around the behavioral factor so that we will be able to x-ray our closets to see what are those hazards that are there and how can we put up mitigation in order to minimize exposure or rather eradicate it. So if we begin to look at these social environmental factors related to this NCD, I started my journey to look at the Sustainable Development Goal, which I am sure is ringing a bell. SDG 3 and SDG 8 is talking about good health and well-being, as well as promotion of decent work and economic growth. So when we begin to look at some of these goals that have been set up, which I'm sure most of us, if not all of us listening, or almost all of us listening, our country have signed up to these goals. So some of these social environmental factors that I want to spend my time talking to us around is looking at air pollution exposure, indoor and outdoor, and also trying to look at some of the occupational exposure to some carcinogenic compounds. And then we will wrap it up by looking at behavior and lifestyle to see how we need to be aware of some of these things if we are not aware of, so that we will be able to come up with a good plan in order to ensure that ourselves, our workforce, and if possible, our families are not affected by this. Now, because I wear different hats, presently I'm working in Qatar, and the Qatar government have also identified some of this issue within the community, and they came up with what they call the public health strategy. Although this document is old, the new document hasn't come up. But what the data is showing, around 70% of the people residents in Qatar are classed as obese. and around 17% of the people that are based there are having diabetes. Now, that begins to tell the government something is wrong within the system, within the workforce, and there's need for us to begin to think about how to come up. And they came up with seven objectives, which they are now trying to push through the community in order to see how we will conscientize the community, conscientize the workforce in order to minimize health impact associated with behavioral side of things. Also, my origin is from Nigeria, and I delved into the internet, and I could see that there is a national health promotion policy. And part of this policy have set of 4 objectives, all trying to push the health and well-being of the community. And one key phrase that caught my attention there is saying mental health condition alongside others that I have highlighted there is on the rise. So we can begin to see different community, different setup have different goals which they are trying to address. But the main thing is to ensure that our workforce are healthy in order for us to have a productive economy. Now, also, I have looked at England, and I have came across this PHE strategy, and we can begin to see that they all mirrored what is happening within the community. Now, the question that I ask myself is, how did we get here? How did we get here? We talked about obesity, we talked about diabetes, we talked about mental health and others. Now, for me to work my way back, I think we need to understand this health hazard across generation. Now, I put up this slide in order to take us back for us to begin to see where man begin to get exposed to some of these hazards that are likely to affect his or her health as he or she continues along the path of life. Now, in the middle, we have a pregnant woman. Let's think about it this way. What are those things within the indoor environment do we think that a pregnant woman is likely to be exposed to that is likely to affect this unborn child? Now, when I moved to Qatar, I had that light bulb moment. Everywhere I go, I find incense is being burnt. And we know it produces this aromatic smell, which tend to attract people to burn it all over. But deep inside of these incense or wood that is being burnt, we know that some of the compounds there are not good for health. Now, let us assume the woman in the middle who is carrying this fetus in herself is being exposed to these pollutants. What do we think is the fate of this child? Now, let's assume after 9 months, this particular woman in the middle has given birth to that child. And I know different community that we all belong to. We all have different ways of in which we allow the mother to rest before the child is brought into the world for him or her to be saved. Now, let us assume this child that is born, the mother is expected to spend maybe 2 weeks indoor in order to regain back her strength, and she will be pampered with all this incense being burned and perfume and other things being released into the environment. What do we think is happening to this child? The child is already being exposed to some of these pollutants that are likely to affect his health in the long run. And when the child begins to crawl in the indoor, let's think about it. What are those things that he or she is being exposed to in the home? And when he begins to go to school, interact with the community, what are those things that are outdoor that are likely to affect him? So we can begin to see when we follow the life cycle of this child, even right from the womb, before he or she gets to that age of the working age state, he already or she is already being exposed to some of these pollutants that are likely to build up and affect the well-being of that individual as he grows. So I'm not going to talk much about this model, but I'm sure it's ringing a bell to a lot of us. But let's think about it this way. The child is born within the community, the child grew up in the community, and possibly the child is going to work within the community. There's that need for us to begin to look at what are those things that are likely to impact on the health of that child, either at home, in the community, or in the place of work. We all have that duty of care in order for us to begin to think about the prevention of some of these pollutants getting into that child even before he gets into the world of work. Just before I left the UK, this was an interview which I have granted to the Chartered Institute of Occupational Health and Safety, IOSH. And part of the message which I have made it clear in this interview which I have presented, air quality and pollution are very much within the remit of professionals. We all have a duty of care. And that is why I'm building that picture. That duty of care does not end in the office, but let's begin to look at the indoor environment that we all reside in, we all interact in, and see how we can control some of these pollutants in order not to impact on ourselves, on the child, and the workforce that we are responsible for. So when I begin to expand on this, we will see that in the indoor environment, there are different sources of pollutants that are locked in there, right from our kitchens to our bedrooms, down to the bathrooms and other places. These pollutants are all over. There's that need for us to begin to risk assess our places of work, our homes, and other community in order to see what are the pollutants that are there, what are the hazards that are there, and how can we minimize exposure in order for us to have that healthy workforce that we want. Now, just to draw our attention to some of the work that we have done. This was a research that we have done with one of my master's students while I was still here in Manchester. And what we decided to do was to assume that that child now has begun to work, and that child has taken up the profession as a hairstylist when he became an adult or she became an adult. So we followed that child into that place of work, and we placed our sensors for almost a month in that place of work. And these are the results of our data that we have collected. We collected PM 2.5, CO2, and other pollutants. And you can see the peak that we are getting from this place of work. Now, let's pause here. If we have ever visited any of these salons, we know there are cocktails of chemicals that are being used either to treat the hair or to do one form of activity there. And these are all things that we have found that have added to these pollutants in the indoor environment. And when we began to survey this place of work, the ventilating system is just fan extract that we find in most of these SMEs that we visit there. And majority of these have not been serviced. So let's think about it. The child that is working there, the customer, and possibly the friend of the customer, and the child that accompanied the customer, everybody is being exposed to these pollutants that are there. Now, some of the response that we gathered from this workforce that responded to our survey are things around respiratory allergy, contact dermatitis, itchy eyes and nose, and other forms of occupational diseases. These are all things that they have reported. And we put forward a recommendation to each of them for them to begin to think about how they can think of the indoor environment and try to improve their ventilation there. Now, modern urban lifestyle is something also that, depending on where we are, there are different sources of this air pollution. Now, when I was doing my studies, we are meant to understand that mobile sources are things such as chimneys and other things. But now let's think about it this way. We have cars, we have other we have all sorts of automobiles that are generating these pollutants. Now, let us imagine during the peak period, either here in Manchester or wherever we find ourselves. Let's imagine that child is stood by the road with his mother or the father or the family waiting for the bus to come and pick him up. Assuming that child stood there for 15, 20 minutes, let's think about the amount of pollutants that that child is being exposed to. So that tells us that these mobile sources of air pollution is right within our immediate environment, and there's that need for us to think about it. We know here in Britain and other parts of the world, secondhand smoking indoor has been banned. Yes, in the place of work, that is something that has been banned. But the question now I put to us is, what about the other indoor environment that we find ourselves in? Is this type of activity still taking place? If yes, then the child is being exposed even before he gets into the world of work. So these are also associated with individual lifestyle. And as I have said, I've given us already example of some of this that we also need to risk assess to see how we can prevent ourselves from this, from being exposed to. This is an old data, but I think it's going to ring a bell to some of us, if not all of us. Based on this data by Lancet on WHO in 2004 is associated with smoking. And for the children, that child under the age of 15, these are some of the associated health-related issues that he or she has to live with. Now, let us assume that child that I have given painted that scenario. Think about the load of pollutant that he has been exposed to right from the day that he was introduced into the world. And up till now, that child is being exposed to different forms of pollutants. This is adding up to some of the burden of diseases that we are having within the community. Industrial and manufacturing sources also are things that we also need to be aware of. The question that I want to ask us here is, what do we do with our old mobile phones? What do we do with our old electronics? What do we do with our old television and other devices? Do we put them through the bin, or do we recycle them responsibly? These are things that are likely, when we look at the life cycle of how these things are being processed, they are likely to come back and haunt us in our place of work or within our community. I know asbestos is something that has been looked at. Silica dust is also something that is showing up its ugly head among the workforce. And we know that it has some similarity with asbestosis and other related diseases. And these are things that we also need to look at it, not only within the place of work, but within our closest to see how we can mitigate, or rather we can reduce exposure of this. Now, coming back to e-waste. Now, let us assume that your old computer, you put it through the bin or you take it to that recycling site, and that computer is not being recycled properly, and it found its way maybe to any of the global south countries that recycle this. Now, I want to paint a picture for us here. Think about it. Most of these electronic waste, when they find their way out of the countries of origin, some of them are not recycled responsibly. Now, let us assume this recycle take place in a crude way. It's been set on fire outdoor, and the rain fell. The pollutant that are in the soil, the rain washed it into the stream that is close by to that irrigation farm that somebody is farming, let's assume banana or vegetable, whatever it is. And I know for some of us that are residents out here, if we go into our Asda, Tesco, Sainsbury, or whatever shop that we shop around, there is no season that we do not find the fruits that we love. Let us assume that water is being used in irrigating that fruit that we love to eat. What is happening now is coming back to haunt us. So there's that need for us to begin to think about how we can manage some of these e-waste so that it does not come back to affect the work, the active population or the general population, so to say. So as part of the studies that we have done, this was a study that one of my master's students, this is just recently published, who traveled to Ghana, one of the waste disposal site called Abogloshe, and he spent a couple of weeks there trying to gather information among these e-waste handlers. And what we found there is safety competence was very poor among these workers. There was lack of training, poor knowledge around relevant safety information on what they are handling. They do not even understand what they are handling there. Injury and illnesses as a result of the work they are doing, as far as they are concerned, is an act of God. So there's that duty of care that we need to think about how we sustainably dispose some of this waste. And another PhD student of mine is now writing up her thesis, and she also is looking at this e-waste recycling activity in Nigeria. Just this morning, I was reading through her last chapter, and it's so many revelations are coming out of it, which is a little bit scary, but we all have that duty of care in order to think about how we sustainably dispose our electronic waste, our batteries, and other nasty compounds that are locked in our places of work or in our houses. We also took another research looking at this silica dust exposure among small and medium enterprise construction workers. And also what we have found, there's high potential of this dust exposure with little or no safety precaution being applied there. And also what we understood there is the lack of awareness among those that took part in our studies. They do not even understand what we are talking about, and sometimes we have to break it down to their basic language for them to understand what is the silica that we are trying to talk about. And this paper also is in press. We are trying to get it out as soon as possible. Now, let us think about agriculture as well. Pesticides, mycotoxins, veterinary pharmaceuticals, and other things are things that maybe they are not within our control, but we can think about how we source our foodstuff in order to limit the exposure to these pollutants. Now, as part of the interest I have in this study, what we did was to look at the safety, knowledge, attitude, and practices among farmers in northern parts of Nigeria during the pesticide application. And things that we found among these farmers, the use of these empty pesticide containers for other secondary use. Some of them are using it for other things on the farm, as well as taking it back home to use it. And also the lack of awareness and lack of good safety behavior during the application, people eating, drinking while handling these pesticides. And generally, what we found is the safety behavior is influenced by socio-economic factors of these workers. Those that have attained good education, they are aware of some of these, and to a certain degree, they are trying to prevent themselves from being exposed to these pollutants. And when we began to take inventory, my apology, I don't know if this table is large enough to understand what type of pesticides that these farmers are using. As you can see on the keynotes at the bottom, WHO classification 1 stands for highly hazardous, down to unlikely to present acute hazards. We found out that around 2% of these farmers that have told us what they are using this category 1 compound, which we know is highly hazardous. And that takes us back to this NCD, non-communicable diseases that I have started talking about at the earlier instance. So what we did was a workshop that we organized and invited other professionals across the global south, Nigeria, Africa, in order to see what are those issues that are associated with this pesticide exposure and how it's affecting the workforce. Now, as part of the communique that we have come up with, which we have published it, public health research priorities, knowledge and risk perception of the population is something that almost all of us agreed. And when we looked at the most pertinent policy problem is the insufficient implementation of these policies. And you will agree with me, for some of us that have that lived experience in some of the developing countries, policy implementation is something that is still an issue there. And there's that need alongside others for us to begin to think about how we can push that either through the activities that we do or through the network that we have out there. Now, let me trying to conclude here and draw our attention to some of the things that the research that has taken place just after the pandemic. And to start with, I came across this data. I didn't take part in this, but it is something also that might speak into our immediate place of work or into our immediate life. And this was a data that was being published by the European Agency for Safety and Health at Work. And what they tried to do here was to look at the safety and health during the post-pandemic workplace. And as part of their theme, they tried to capture 5 themes, but the 2 that I felt could fit into our conversation are those 2 themes around psychosocial risk factor and health issues and the mental health in the place of work. Now, based on the study which they have done across Europe, 46% of the respondents said they are exposed to severe time pressure or overload. And 26% said poor communication or cooperation is something that is happening within their organization. And also lack of autonomy and lack of influence are things that are slowing their work down. Now, in terms of mental health in the workplace, disclosing of mental health condition, some shy away from it because they feel it have this negative impact. It will have negative impact on their career. And also around 6 out of 10 of the respondents said they will feel comfortable speaking to their manager or supervisor about their mental health state, which is a good statement. But the question is, do we create that safe environment where we encourage people to come and speak to us? And I believe this is something that we really need to look into it in order to ensure that we have that healthy workforce, in order for us to ensure that some of these issues that we have talked about alongside stress and mental health does not show up in a place of work. Now, as part of the work that we have done, this is a work that one of my PhD students is doing. And what she tried to do was to compare data between UK and China. She's originally from China. And what we tried to do was to look at the quality of work life there. And those that responded to the survey that we carried out, majority of them are also saying they are working under pressure during the pandemic, which almost all of us, we felt the same. And also, a lot said they felt excessive level of stress associated with their workload. And just this evening before we spoke, one of us was traveling. I was meant to understand is traveling from one point to the other, trying to cover up for the medical health personnel that are on strike or on the staff. So these are all things that are happening within the place of work that we need to think about. What are those things that we can contribute in order to minimize some of these issues? Remember, I have put forward almost 7 hazards that are associated with the workplace, and these are things that are real that we need to look at. Now, as part of my own research, we looked at occupational stress and what we call situational awareness among offshore workers who spend between 14 and 28 days offshore. Now, when we interviewed these offshore workers, these are some of the things that they are saying. Issues at home, because of my absence for 2 weeks can sometimes bother me at work, and that can increase my desire to go back home, which can reduce my concentration at work. And we know that when concentration level drops, especially within the high risk industry, there's that tendency of accidents or incidents to happen. Now, 28 days can seem very long if work is not interesting and challenging. This is food for thought for all of us. Do we make our employees enjoy what they do? Do we make our workplace to be interesting and challenging? This is the voice of somebody saying, I need it to be interesting so that I can remain focused. I condition my mind to be locked in for my 14 days straight, and I rest once I am on time off. Yes, we know that sometimes, especially among us male, we tend to block our mind towards things happening. We tend to keep it in there. And sometimes that is not the best way forward. Now, I deliberately put forward this because this is something that touched me this week. I went into the university to meet with my students, and I inquired about one of my students, and I was told that this student jumped in front of a fast-moving train and he ended it. So stress is real, mental health is real. And that is why I'm using this medium deep from my heart to talk to us, for us to look inward and think about how we can create a safe place for people to be able to speak so that we'll be able to address this. And also, I remember when I started my work in Qatar, I noticed one of my students was not attending class. And I called the student after the class. I said, your attendance is poor. And what I got made me to begin to think inward. And in her words, she said to me, sometimes I don't have the energy to leave my bed. And I know that something is wrong somewhere. And she confided in me and some of the things that were coming up. And I knew that she is almost at that tipping point. And we had to put contingency in order to salvage that situation. So with this, I want to leave us with these points for us to consider. HSC, Health and Safety Executive, have put forward these 6 main areas that can lead to work-related stress if they are not managed. When our staff cannot cope with the demand of their work, it's going to affect their mental health. When our staffs are not able to control the way they do their work, it's going to impact on their mental health. And also when we do not release enough information and support, as well as when they are having trouble with relationship at work, or they are being bullied. And if we do not make our workplace interesting, they will not understand their roles and responsibility. That also is going to affect the stress and mental health they are likely to experience. And lastly, how do we manage change within our business? If we do not handle that properly, that also is likely to create an issue. So in conclusion, I think there's that need, in my own opinion, for us to think about it, ask ourselves this question. How do we communicate risks to ourselves? How do we communicate risks to others? Do we raise our voice when we are communicating risk, or do we raise our words when we are communicating risk? Previously, I used to raise my voice, but I understood that that is not going to work. So I have found a good way of raising my words in order to communicate risks in that simple term, so that we can begin to look at how we can have that healthy workforce and reduce fatigue, and also reduce any related issue that is likely to come up. So I want to leave us with this Chinese proverb. It says the best time to plant a tree is 20 years ago, and the second best time is now. Now is time for us to look at ourselves and think about what are those hazards that are locked within our closet, in our community, in our place of work, and try to think about how we can manage it so that any of these issues that I have presented, we stay far away from it and we have a vibrant working life and enjoy a good quality life. This presentation will not be complete if I don't mention the students that I have been working with. Stella, who is writing up, Abdul is writing up, Yijuan, she is almost at that stage. Brendan, Chamara, and Semiu, they are just halfway through their work. And this gentleman, may his soul rest in peace as well. They are dear to me. And also the number of master students that I have worked with, and I'm still working with them. I say thank you to all of them. Thank you for listening.
Thank you so much, Dr. Moda, for such an inspirational talk session.